Hello everyone, my name is Dr. Muskaan Chhabra and I'm working as consultant IVF at Birla Fertility in IVF Lajpat Nagar. So आज का टॉपिक है कि how will we improve the outcomes of the IVF cycle that we are undergoing. It is very important to understand कि how we can get the best out of the IVF cycle and the egg retrieval process. The first step to understand is that we have to reach the correct diagnosis. It is important to understand why we are not being able to conceive. What is the cause of our infertility? Is it a tubal cause? Is it that there is an ovarian cause? Is it a male factor infertility? It is very important to understand where we are going wrong so that we can correct that factor and only then undergo the process of IVF. The second most important point is that IVF से पहले हम अपनी बॉडी और अपनी हेल्थ को ऑप्टिमाइज करें और उसके बाद ही IVF साइकिल के लिए प्रोसीड करें. So pre-treatment before IVF cycle is very important. It is important that your full battery of tests are conducted, that we see what is your AMH level, what is your prolactin level, what is your thyroid level, are your vitamin D levels okay, and what is the semen analysis of the husband. Once we have completely analyzed and seen the reports, only then we can confidently go ahead with the IVF cycle. So it is very important that we do the initial investigations and only then proceed, and also give some pre-treatment in the form of coenzyme Q, in the form of thyroid supplementation if required, in the form of any vitamin D supplementation if required. And we also check other baseline parameters of your health, such as your hemoglobin and your viral markers and your rubella and thalassemia status. The third very important parameter which will define your success in your IVF cycle is your baseline scan. Usually we start the IVF cycle on second day of your period. On the second day of your period, one baseline scan is conducted to see whether your ovaries are quiet and whether your endometrium is shedding properly. This scan is very important, and if this scan is normal, then and we start your stimulation at the correct time, then the treatment outcome and the quality and the quantity of the eggs that we will get will be optimum number. The next most important thing to consider is the injections and the drugs that we are going to give. So for every patient, we do something that we call as an individualized controlled ovarian stimulation. Individualized controlled ovarian stimulation का मतलब है कि हर पेशेंट के लिए जो प्रोटोकॉल फॉलो किया जाता है, जो डोज दी जाती है इंजेक्शंस की या फिर जो ब्रांड दी जाती है इंजेक्शंस की, दैट इज़ डिफरेंट एंड दैट इज़ स्पेसिफिक टू द नीड्स ऑफ दैट पेशेंट. सो we will give if we give the correct dose and the correct quality of drugs for the stimulation will be good, and the quality of the eggs that we will retrieve is also going to be good. The next important parameter is that you take all your medications and all your injections at the right time. Timing is everything in IVF, and it is important कि आपके डॉक्टर जैसा आपको प्रिस्क्राइब करें, जैसा आपको गाइड करें, आप उस हिसाब से अपनी मेडिकेशंस लें और आप अपनी इंजेक्शंस लें और उन इंजेक्शंस को करेक्ट टाइम पे लें, जिससे जो एग रिट्रीवल का प्रोसेस है वो टाइमली और प्रॉपरली हो और हमें प्रॉपर मैच्योर एग्स मिल पाएँ. Most important injection in this whole process is the trigger injection. आपको जो ट्रिगर इंजेक्शन दिया जाता है दैट इज़ 36 आवर्स बिफोर योर oocyte retrieval. और इस ट्रिगर इंजेक्शन का काम ये होता है कि दिस विल मैच्योर द एग्स दैट आर प्रेजेंट इनसाइड योर ओवरीज. इफ इट इज़ टेकन it has to be taken properly and it has to be taken at the right time. If it is taken properly and at the right time, then the quality and the quantity of the eggs that we retrieve is going to be good and we are going to retrieve mature eggs which are capable of fertilization. Last but not the least, it is very important to assess the male factor properly. अगर husband का semen analysis properly हो रखा है, and if we are sure that the motility, the count and the morphology of the sample is good, then only the egg retrieval process and the eggs that we have retrieved are going to give us good embryos. So we should be sure that the husband sample is proper, and there is not much abstinence before we take the sample on the egg retrieval day. In case required, antioxidants can be given to the husband to optimize the semen sample as well. If we take care of all these things, we can ensure that our oocyte pickup, IVF and retrieval process goes without a hitch, and we get best results from our IVF cycle. Thank you so much for a patient hearing. In case you have any questions, please feel free to comment in the comment section below or reach out to us at Birla Fertility and IVF. Thank you.